هلا
هذا الحاج ساعتين
بعد نص ساعة.
ايه يعني الساعة 10.
ايه
بس شنو الحاج؟
احنا المطلعين ايش رايك بالرخام؟
الارضي ولا الطوبة؟
ولا بالرخام؟
يا فتح
ايه
بالكيف
الله يرزقنا من
اقول
فضله.
لك
هذا
انت ما اجي المكان اشوفه انت تصور.
Two internists,
بالله.
one internist, two endocrinologists, two cardiologists. And we're going to tackle starting with the Slovenia, inshallah, so from different countries as well, so we can have a flavor of that. We'll start with Dr. D.Abdallah. He's a specialist in internal medicine and cardiology, trained in UK, and the score is great. I've never seen a score like this, 99.
Story. And I think this is a wonderful program by Beatrice because storytelling is a part of physicians' life. And I think, as English people say, the money in diagnosis starts with listening to stories rather than reading patient's investigation and echoes and whatever. So let me start with
Zain, a 37-year-old man, is happily married and living with his wife Sarah and his son Anne. He works at a big company and he's well recognized at his workplace. He's happy with the salary he gets, but he doesn't enjoy the long hours seated on an office with daily routine tasks. Once his working hour finished, he comes back home to Sarah and Adam. They both start demanding to go out, and he barely rests, taking them out from one place to another. After all, he wants them to be happy.
It's a real story of a middle. It's not a real story, but it's a story which we see in our daily practice. That it starts at 40, right? I just became 40. So he's 42 years old, and he's male. He's 31 kilograms. Look at all these risk factors. And he's smoker, and his blood pressure is 135. Look at his LDL cholesterol is 142. So apart from he's not diabetic, fortunately. So this is how Zaid looks like. When you see a patient like this in your clinic, what would you do? How we can clinically assess this patient? How we can, now a new paper has been published recently, very high risk of getting events, like some people, they have 3, 4 vascular events within a year or so. So this is very important. The scoring system, so if you are diabetic, you have CKD, if you have a vascular event, whether it's a cardiac or cerebral or peripheral, so you get a higher score. And of course, creatinine carries the same weight as the ejection fraction and as a stent in your heart. So it's very, very important to check your patient's eGFR. We will talk about this even before prescribing a statin. So let's move on into,